How to perform wound irrigation and how to change dressing. So in doing this procedure, you need to assess the patient's level of pain. And of course, you need to review the doctors if there are any doctor's prescription. And the third one is to administer pain medications as doctors ordered. Wash your hands, okay? Prepare the materials and the equipments, okay? For the materials and equipments, I have here, of course, my PPE, okay? The gown right here. I have here clean gloves. I also have here the sterile gloves. I'm already wearing my face mask, all right? I have some gauze right here. I have the dressing tray sets, all right? I have the asepto syringe for flushing, all right? I have here the adhesives, okay? And then I have here the normal saline solution, all right? Then you need to explain to the patient what you're going to do. Introduce yourself, of course. Provide client privacy. Okay. Good morning, Mr. Adams. My name is Mark, and today I will perform wound irrigation and wound dressing. Would that be fine with you? And he says yes. Okay. Can I have your full name, please? The patient will say his full name. Can I have your MR number? All right. Then you need to position the patient correctly. In case right now we have wounds on the buttocks area or sacral area. So you will turn the patient to one side, all right, away from you, making sure that the side rails are up for safety reasons. And make sure that it is positioned in a way that when you irrigate on this direction, the water will flow by gravitational direction. All right? Okay. You may have to obtain a kidney basin, all right? And you have to put it directly under the wound so that when you irrigate fluids right here, the fluid will flow directly onto the basin. All right? Next, you need to, of course, wash your hands. Prepare the sterile field, prepare the sterile setup, and prepare the sterile solution. Okay? So, this will be my sterile field right here. Okay? I will open the dressing tray set. Okay? Take this one. Use. Okay, I will touch only the refuse, okay, and avoid touching the sterile field, alright? Okay, this one, you need to open the cup of the plastic refuse. This is where you will put the all dressings and the other soiled equipment, and put it beside you near the area. Have some put an underpad right below the area to be irrigated, so that when you irrigate, there will be no soiling of the linens and even the bed. Okay. Next, sterile setup. So in this sterile setup, included here, we have cotton balls right here, we have the gauze right here, we have a sterile forceps, then we have the towels. All right. Next, you need to pour. Okay, this will be the sterile container. Okay, pour the sterile solution on the container using a sterile technique, pouring technique. Pouring technique. When you pour the solution to the basin, the tip should not touch the sterile area, okay? Then, of course, this is asepto syringe and this is sterile. So, I will just open it. And I will just put it here. Okay? We need to prepare our adhesives right now. Then, you need to don clean gloves. Okay, then you need to remove the slowly. And then of course, you have to discard together with your clean gloves. Is to inspect the wound. Inspect the wound for any inflammation. The wound and its surrounding tissues. Are there any discharge? What is the color of the discharge? What is the amount of discharge? Everything you need to write down on your nursing notes. Okay? Next is you have to put on the sterile gloves. Okay? Now, I need to have normal saline. Okay? Using a septo syringe, 2.5 centimeter above the wound, you have to irrigate. You need to fill. I fill it already. I hold the syringe 2.5 centimeter above the wound. Then I will flush it with continuous, slow, continuous pressure. How many times we should repeat this? We should repeat it until the water that comes from the wound is already the same color as your normal saline. But there are wounds with deep wound but small opening bus. If that is the case, you may need to use an angio catheter, gauge 19. And this will give you strong pressure, so that this pressure can reach even the insidemost portion of the wound. And you need to dry the wound completely. Apply the gauze. Then you need to remove the gloves. Okay? And then you need to put the adhesive. Okay? I will now remove the PPE. Then I'm gonna wash my hands, okay? Then I will evaluate the wound, the patient's response to the intervention, okay? And then do the aftercare.